Is that correct?
But that is correct, yes. The fine right now is 2.5% of your adjusted gross income, or the penalty of your adjusted gross income. So many people, if you average only making $30,000 a year, that fine is very small compared to paying for insurance every month. $400 a month or so. $300.
Is $400 the average right now?
No, I think the average is much higher than that. I mean, the younger person is probably close to $300, but the older people are probably closer to $900. Somebody 55, 60 years old. Yeah. I mean, that's assuming you don't get a subsidy. Now, if you're subsidized, then the government has a subsidy based upon your income. If you're under 250% of the poverty level, you can get a subsidy from the government to pay for it. But if you're above that, then you're paying the full thing. I have one client who needs a full-blown health insurance because he got a lot of medical issues. And his insurance for him and his wife this year is $29,000 for him and his wife.
Dang. No kids, just them two.
Just us. I mean, they're in their 62, 63 years old, but that's a lot of money. $29,000 a year is a lot of money for health insurance. And in their case, they got some issues, so they need that. I mean, they can't go without it because he's got a bunch of things wrong with him.
And what is the age where you cut out where you can't include your kids on your plan?
At 26, you fall off the plan.
Okay, at 26. And when does the repeal that just happened recently, when does that go into effect?
January 1, 2019.
Okay, so we got one more tax go around.
Correct.
Basically. Okay.
Yes, correct.
So January, is that tentative or is that a definite?
No, that's a done deal.
A definite. January of 2019.
Yes.
Okay, excellent. And what else is happening that we should know about in healthcare?
Just the biggest thing is that you've seen in many markets there's only one insurance carrier. So you've seen a lot of places, like in the state of Iowa and Nebraska, there's only one carrier. It's a company called Medica. They stayed in the market, and they had basically a 70% rate increase this year versus last year because they were the only carrier, and they were going to leave too. But the insurance commission talked them into staying, or got them to stay. But of course that came with a price to do that. So.
And that's in Iowa.
So that's in Iowa and Nebraska. That's one of the states there that got hit really hard. Last year, I guess it'd be this year. It's still this year, but the 2017 year, the enrollment period was obviously the end of 2016. Arizona had a 116% average increase, for the state. So it was baffling that actually Senator McCain voted against the repeal of the health care law, but when it was on the Senate floor, he was the one that voted the wrong way. When he campaigned on repealing Obamacare, yet he was the deciding vote to keep it. When his state got the big law, it was kind of shocking there, in my opinion. But it's, right now healthcare is very health. See, the other problem, Demetrius, is we have to separate healthcare from health insurance. Two separate things. Health insurance is what helps you pay for your healthcare, and as soon as they realize that the cost of care is expensive, that will change. They may work differently on the cost of health insurance.
Wait. Say that again.
See, for some reason, health care and health insurance kind of got lumped into the same thing, the same category. But in reality, health care is like when I go see the doctor or the dentist or the hospital. That is health care. Health insurance helps you pay for your health care. So, I mean, they really need to clarify that, and they keep talking about, health insurance is expensive. Well, health insurance is expensive because health care is expensive. If they find a way to reduce the cost of care, then the cost of insurance would go down.
Do you think that's possible for them to do it that way and reduce the health care costs? Are we on path of that possibly happening, or are we
we're starting to see a shift in some places, and I was writing an article on this today. There are now physicians called direct primary care physicians. where they don't take insurance. They just go straight on either a subscription basis, maybe $100 a month subscription to see the doctor when you need to, or, maybe it's sometimes it's a $75 per visit deal, but stuff like that would bring cost of care down if they went to that route where kind of like back to my HSA argument there, where, you pay for the small things yourself, because then there's two things. One, I'm not rolling out of bed with the sniffles and running to the doctor if I have to pay for it. If I only got to pay $20 for it, well, then I'll go. But I mean, somebody's paying for that bill, just not you. So if people had more skin in the game on the littler things, they might take a more interest in their health care or in their wallet. They may shop around for a lower price. They may utilize a quick clinic instead of the emergency room. A Walgreens or a CVS, have those little quick clinics now. They may utilize that instead of going to the emergency room, where it costs more. So I think there are ways to do this, to drive the costs down. It's kind of like, if you look at cosmetic surgery is actually pretty cheap to get done because it's usually not covered by insurance. It's usually a cutthroat business, people trying to get the best deal. So that price has come down. So I mean, if you take away not the middleman, people don't know what things cost because their insurance is always paying for it. I go, that only costs $20. No, but the visit might be $250. But it costs you $20. You're used to having a copay. So I think if people, if prices had to be advertised, if going to the doctor was like going to a restaurant where the price was posted and, physical is $125 and sick visits $80 and, tetanus shots $120, whatever, it's posted when you get there, then I know, then I got to decide if I want to get that service done. Or do I want to see if there's another doctor in the area who will give me a tetanus shot for $90 instead of $120? And that's what's bringing costs, and that's how costs come down.
And so, do you think cosmetic work should be included or covered, or no?
No, I don't think it should be. I think anything that's elective should not be covered.
Well, what if someone gets burned in a house?
That goes back to the benefit necessary. I think things like that should be covered. Yes, I think just opting for cosmetic surgery because I want to get a new nose or I want to get liposuction or something along those lines. Bigger breast. Yeah, then that should not be covered because that's a choice that you make, which is nothing wrong with that if that's what you want to do. But stuff like that.
I never heard that before. Healthcare is expensive. It's not necessarily the health insurance.
Right. The cost of insurance is a derivative of the healthcare cost. So,
I never thought about that.
Yeah. Well, why does an MRI cost $3,000 someplace and $750 someplace else? It's the same machine. Does the same thing. Why does the insurance company charge, you were talking about discount, because basically what a discount plan does, it kind of gives you the insurance discount when you go. Why is there an insurance discount? Why isn't it the same regardless? Why doesn't my doctor visit cost $100 if I have insurance or if I pay cash? Why isn't it the same? Should be. You're doing the same test, right? If you and I both go to Walmart to buy a dumbbell, we both go to buy the 5-pound dumbbell. It costs us the same, no matter who our insurance is, no matter where we come from. It costs us both the same price, right? So why does healthcare give one company health insurance give Blue Cross one discount and Humana a different discount? But you're out of network, so you got to pay twice as much because you're out of the network. The services are the same. My body doesn't know, that it costs more. It costs the same to me.
And what form of payment would you say doctors, dentists, what form of payment do you believe they prefer the most? Insurance or cash?
Well, I think it depends on, obviously cash, you get it now. With insurance, you get it, 60 or 90 days from now. But they typically bill the insurance companies more than they bill cash. So, I think it depends on what you're doing.
But also, isn't it true that in some cases they don't even get the money? Is that true?
In some cases, yeah. I mean, well, usually they do. In some cases, it's true. I mean, you see claims denied for various reasons where they don't get paid. There's people try to file fraudulent claims. I'm dealing with a client now who has about $70,000 worth of medical bills, and the problem is she fell on a commercial property. So the insurance company is saying, well, that property is liable, which that property is liable if you have, so this is like if you have a business and you don't shovel your snow, and I fall on the ice, you're liable for my medical bills because you didn't shovel your snow. So in this case, that place is liable, but getting these people to pay for it is becoming very difficult. So the insurance company is saying, well, we're not paying for it; they're liable. These people are saying, well, we're not liable. She just fell, or she shouldn't have fallen on the property. So who knows who's going to get paid in this deal?
That's really good. Really, really good stuff. And I guess as we're winding down, again, everybody, this is Eric Wilson from iSellHealth.com. And I don't think, I mean, you have anything else anything else maybe I didn't ask about?
No, I mean, I think you've asked everything. I think there's,
anything we need to know about diabetes or stuff like that?
Oh,
insulin.
I mean, insulin is very expensive. So I mean, insulin is one of those drugs that when the Affordable Care Act passed, the price suddenly kind of doubled as well there, and I don't understand why. And that's one of those medications I don't understand why certain medications suddenly cost more than they have for the last decade. There might be a valid reason. I just don't know what it is. But it seems like insulin is one of those drugs there that it almost seems like they're taking advantage of sick people on that one to me. Meaning the pharmaceutical industry, and I don't have to be factual. It's just my opinion there. So, but I mean, I think obviously exercise helps too. I mean, I think part of the healthcare system is take care of, if you treat your body like you treat your car, and you get your oil changes on your car, and you wash your car, and keep the rust off, and keep the snow off, if you take care of your body, you're going to be healthier in most cases. And and some of that stuff, you limit your sugar intake and those kind of things, and sometimes, drink enough water. Sometimes you can cure a lot of things just by a good diet.
Mind over medicine?
Yeah, right. Yeah, right. Mind, that's a good point. Good phrase. Mind over medicine.
Do you think there's some truth to that?
I think there's. I think in a lot of cases, if you have a good diet, you're healthier. I mean, you see people all the time who just lose weight by changing their diet. You see people who are when they call them borderline diabetic, where their sugar level is getting too high, their weight's getting a little too high. Doctor says, hey, you gotta lose some weight, you gotta do this, that, and the other. And next thing you know, they change their diet, they change their exercise habits, and suddenly sugar levels go down, and they're healthy again.
And the future of healthcare, if you had to say, is what?
Future of healthcare. I think the future of healthcare, you're going to see a lot more of the direct primary care physicians. A lot more doctors not dealing with insurance, just going straight to the consumer. I think you'll see more consumers paying cash because the insurance is more expensive. It's easier to pay cash and cheaper to pay cash in many cases. So I think you'll see that. Maybe even like a subscription kind of thing. You might even see a subscription type deal. And then, with like you pay a monthly fee for your insurance. Instead of paying a monthly fee for your insurance, you pay a monthly fee to the doctor's office, and you get unlimited consultation with him. So I think telemedicine is on the rise, and I think they're two big things. The direct primary care and telemedicine are going to be the two big things in the next couple of years.
Awesome. Well, if you don't have anything else, you have anything else, or is that everything? Because I'm good. You gave me a lot to muster on.
I think the other thing to look at as the healthcare law starts to crumble and the penalties start to go away is people need to look at both indemnity